So uh, this is a very important topic, and it concludes most of what we have discussed this morning, and all these knowledgeable presenters have discussed. Um, so my presentation is not meant to just judge any journal or article, um, because some of the articles, even some of the journals, may have low impact factor, but they may be relevant to a specialty. Some of the journals may have a very high impact factor, but they may not be relevant to your specialty. So it's very important that we should not judge. Impact factor should not be the only consideration when judging the quality of a journal or an article. So, but impact factor is an important consideration when judging the quality. So it's one of the consideration. It's not the only one. And uh, uh, KKESH, we calculated the average and impact factor of for the year 2020, and it was just above 2. I would be recommending or the use of a median impact factor, because that's more stable, and that will not be subject to a lot of variation because of one or two articles. So we are actually aiming or targeting these red lines, impact factor from 2 to 5, and only 7% of the world journals are 5 plus. 20%, around 20% are +3. So as you go up, the proportion decreases. So this presentation is organized like these are some of the issues I'll be highlighting. How to be a good researcher, what are the common reasons for rejection, what are some of the characteristics of accepted paper, how to write better, especially the discussion section. So as everyone will tell you, there is no, and this is for beginners as well as for everyone, there is no shortcut to good quality publication. There is no shortcut to designing, conducting and publishing good quality research. Most people grossly underestimate the effort needed to publish a good paper. So it takes a lot of effort and time, and I really like this this snap which I took from Google image, and there is no elevator to success. You got to take the stairs. And now KKESH has also been asking us to use stairs because its use is healthy. So how to publish? I mean, it's a difficult job, but but if you are well prepared, if you have a good team, and you can really position yourself to publishing good quality articles. Everyone has its own way of handling his or her research. My own advice to beginners would be, don't include everyone. Only include the core people, and read and understand the International Committee of Medical Journals editors' recommendations and for authorship and the IRB guideline. For example, who will be writing the proposal, who will be collecting the data, who will be doing the analysis, who will be interpreting the data, who will be writing the manuscript, and who will be communicating with the journal. So these are all defined roles, and who will be giving feedbacks. And these are all defined roles. So My suggestion to you would be to read those guidelines again and again so that you have very clear clarity about everyone's role. Make the core team first. Don't include anyone. Don't include so many people. You include the core team first, and then you aid to that core team based on your need. Make your mentor wise. One of our facilitator mentioned it, like many people don't know, but once you build their capacity, they will be more useful to you in future. And communicate well. Communication is a big problem for beginners, so you have to really communicate well, and make effective collaborators. I'll give you an example of if you have collaboration, then it really helps. This is an example of 3 studies published. They're similar studies, the RAB studies, the rapid assessment of cataract blindness study. They are not RAB studies, but a REC study. And they looked at cataract blindness in 3 districts across Pakistan. And the first 2 did not involve a collaboration. And the 4th one, and you can see the visibility. So they're similar studies, but conducted in the same time frame, but they're cited differently, and they've been published in different journals just because of collaboration. And one was published in BJO, which has an impact factor of around 4, and the others in journals with impact factor less than 1. So they have similar policy impact, but different publication impact. Better analysis and writing can increase the impact factor bar. This is an example from one of our students. He wrote a letter to the Lancet. So everyone is once a beginner, and now let us begin. He began in 2004 by writing this letter to the Lancet. And this is his contribution in 2019. He published a review in the Lancet. So, and he, as you can see, this Facebook message from him, it almost took him 2 years. So, as I mentioned, people generally underestimate the amount of effort that is needed. And look at the impact factors. 79.3. The last time I saw it was 59. Now it's, so every time there is a jump of 5 or 10. Training is a missing link between, you need to be very well trained to be able to produce good research, and it's the missing link between between trainees and good research. So lack of training, they're not well trained. Universities invest a lot of money and time in research training. Unfortunately, in clinical departments, this is not the case. And in order for people to be competent in research, they have to be properly trained. Don't leave clinical trials, validation studies, and quality improvement projects at the disposal of untrained people. The consequences of no or poor training: too many retrospective studies, delays in submission and graduation, stress, and that's all. So training is very important. Some simple steps: establish a research agenda. You don't need to work in every field or in 100 different areas. Just focus on 1 or 2 areas and target those. And it's much easier. You will not need to read different literature. All you would need to do is to work in one area and read the authorship guidelines to plan better. Who you need, all you need is like these guidelines are important for making very strong relationships and what kind of people you need. Read and strictly follow the reporting guidelines. The reporting guidelines are very important to make the reporting of different study types, which were mentioned this morning. STROBE for cohort study, case control studies, and cross-sectional studies. CONSORT studies for randomized trials, PRISMA for systematic reviews, and START. STROBE for cross-sectional studies. And the aim of all these guidelines is to make the reporting of studies very transparent. So if somebody reads these guidelines, he or she can really improve their chances of acceptance in good journals. Master the art of writing a good abstract. Many papers get rejected just because the editors only read the abstract. They don't read the full text. So that's an important. Master the art of making publications quality figures. And this is one of the software which is very popular to make very good graphs. So if the graphs are good, you have a good chance. And instead of two tables, if you present two good graphs, that can really really help. Don't forget to write a one-line crux each table, or so that's also important on how you, like if there is a table, how you summarize the table in one line or two lines. Read outside your field. Be ready for changes. I mean, the reviewers' comments are sometimes very long, but you should have the patience to respond to them in a meaningful manner. This is the table I generally use. Like if they make a comment, you need to respond, and where you have made those changes, you should mention it so that it is easier for them to look at the revised draft. Learn to rebut editorial decisions. Not all editorial decisions are correct. Some are wrong. So you should be able to write to the journal that these are the reasons why this article should have been accepted. Be a good observer. So pay attention to details, small things. I'll acquire the essential research language. Everyone needs this. And for example, someone working in want to works in basic sciences, lab, ophthalmic lab research. So they need to acquire all this language. Acknowledge others. We don't acknowledge others and the people who contribute to the different steps of. And there are so many people. If a big study, there will be 20 or 30 people helping you with different levels. So try to acknowledge them. Understand the peer review process. Like for example, this is a traditional peer review process, and author submits the article, and there is a triage, and most of the papers get rejected at that level. So that's why I told, why I mentioned, please pay careful attention to writing the abstract. A good abstract can increase the chances of acceptance. And this is the Lancet editorial meeting. And this is the peer review process at the Lancet. They generally reject 97% of the paper. And only 3% papers are accepted. The BMJ accepts 7%. The BJO accepts 17%. So it's still a very good acceptance rate. That means you have 1 in 7 chance of getting accepted there. Common reasons for rejection: there's no or insufficient novelty, no impact of work, no conceptual or methodological advances, lack of appropriateness to the journal. So these are common reasons for rejections. My experience, population-based studies, or district level studies, marginalized population, collaborative research, funded studies, systematic reviews, and meta-analysis, so they can get published in very good journals. The example of discussion section, some of the common problems editors and reviewers, peer reviewers, they encounter. So in effect, I wanted to, because discussion is the main section, like the abstract, many papers also, once they go to reviewers, they get rejected because of poor discussion section. So what is the objective of a good discussion section? It reveals the strengths and weaknesses of a study, facilitates sound interpretation and application of study results, and guides peer reviewers, editors, and examiners in the evaluation of manuscripts. So problem 1, this is one of the biggest problem, cut and paste material and large chunks of it. There is little or no discussion of one's own findings, presenting too much background or historical information, discussing everything. Like if there are 10 findings, they will discuss. All we need to do is to discuss the main finding, the most striking finding. 2 or 3 findings, or discussing the results not shown in the results. So sometimes that's also a problem. They have not mentioned the results in the results section, but they will start discussing it in the discussion section. Citing references that has no or little relevance, very old, citing outdated references, too descriptive. And this is also a common problem for me or for beginners or for everyone. I mean, the description, like, what does it mean? If there are 10 papers on retinoblastoma and you are reviewing it, so what does that mean? In one sentence or 2 sentences? And that's what my PhD supervisor told me. His first step to me was this: what is your contribution to this? You have mentioned this, this, he said this, she said this. So what do you say? And then I was able to understand what my supervisor said. And I was able to synthesize that or conclude that in one line or one sentence. Conclusion are not supported by the data, so there is a malalignment between data and the conclusion. Keep everything in alignment. So that is the message from today's presentation. Exaggerated claims are made in the discussion sections, and this is Richard Horton, the editor of The Lancet, who also was involved in that by publishing that MMR article in The Lancet, and which was later retracted. And he said the case against science is straight for much of the scientific literature, perhaps half, may simply be untrue. Afflicted by studies with small sample sizes, tiny effects, invalid exploratory analysis, and flagrant conflicts of interest, together with an obsession for pursuing fashionable trends of dubious importance, science has taken a turn towards darkness. The good thing about science is that you accept your mistake. And like the way Lancet did, it retracted that article. So it's a very important, like many of the claims in the discussion section are misleading or wrong, and you have to avoid that. Inattention to detail, word count, caps, punctuation, referencing style, lengthy sentences and paragraphs, lack of willingness to revise. How can these problems be avoided? Follow these checklists. I mean, always they have checklists, and for each and every element of the manuscript, there are checklists. Okay, what should a title include? What should an abstract include? What should an objective include? And what should a discussion section include? So my focus is discussion section because that's the most important. This was published, a checklist was published by the Annals of Internal Medicine. The first step is to provide a brief summary, a 2-line or 1-line summary. And then consideration of possible mechanism and explanations or alternative explanation. Comparison with, the third step is comparison with relevant findings and other published studies. Comparison and important steps in science. A medicine which is work in this setting is also expected to work in another setting, or it may work differently in different settings. So comparison is very important. Limitations of the study, a brief summary of the implications of the work for practice and research. And this is an outline that I would suggest for anyone who wants to write a good or a decent discussion section. This is the checklist, and you can use it. This is one of our studies, and I've used that checklist to fill this template. So the first thing is the first step is to summarize what are the key findings, and then comparison, and then the limitation, and then implications. Okay, so this is an example from New England Journal of Medicine. This is a clinical trial, and this is the first paragraph. In this trial, we compared the rates of loco-regional recurrence of rectal cancer after laparoscopic or open resection.
Excuse me, doctor. Yes. You have exceeded your time. Time is up.
Oh. Okay, so I can conclude in 2 minutes.
Okay, thank you.
Okay, so you see loco-regional recurrence were recorded in 5% of the patients in each of the group. And so the recurrence rates were similar in these two groups. All you need to say in this. And these are the these are the must-have references. You need to have the reference. You divide them into must-have references, nice-to-have reference, not needed. Exclude the not needed ones. This is from one of our studies where a population-based cross-sectional study, the comparison has been made with 5 other studies. This is a study where on DCR where recurrence of watery eyes or epiphora, and everywhere in the literature it was mentioned that it has 100% success rate. And when we listed this in this table, in none of the study, the outcome was 100%. The success was never 100%. So acknowledge the study limitations and, for example, the cross-sectional study, the temporal association, lack of evidence of temporal association is the common limitation of cross-sectional studies. Case control studies, you have the other limitation. Follow-up is a common limitation, loss to follow-up of cohort and randomized trial. And pay attention to caps, sentence structure, exclamation marks, and writing style, small things. This is a criteria for publication in PLOS One. So if you write a manuscript well, you analyze it well, you conclude well. If the conclusions are presented in an appropriate fashion and are supported by the data, then you have done your job. And if the data has not been published previously, I mean, so that means you can target PLOS One, and that's why I have cited. I have presented this slide. This is a take-home message, and as you can see this on the table, there is some messages for the take-home messages. Acquire the skill needed to plan and design better studies. Read more, write less. Read critically and write well. Keep everything aligned, properly edited and formatted. Revise. And this is my disk. You can see revisions of my PhD thesis draft, 6 or 7 drafts or 8, or I may have missed some. And then there are plenty of coffee on my at least 4 cups of coffee. And there is Mucan, the anti-acid or coffee. So revise. I asked some good residents how many times they revised their manuscript, and they told me 10 times. The students who were publishing more, they were revising their manuscripts 10 times. This is the conclusion. Everyone is once a beginner. What matters is where you are going. And thank you very much for patient listening.
Hello, good evening, everybody. I would like to thank all the speakers for the morning session and even for the first session, A session and B session. Would like to thank all the speakers, and hopefully we'll see you at another seminar for the next year, inshallah. Thank you, everybody, and we could conclude our seminar for this year. And good evening, everybody.